Photobiomodulation, light therapy and circulation. Is there a link? Are there benefits? And based on what the research says, yes and yes. Yes, there is a link, and yes, there are benefits. Now, when I say about photobiomodulation, I'm talking about light devices, whether we're talking about lasers, LEDs, etc., etc. And when I talk about light therapy, I include that and just being out in the sunlight, because even out in the sunlight can improve various circulation issues, because we have what's called nitric oxide release, we have blood vessel dilation that occurs, and we have a whole host of other physiological changes that occur just by getting out into daylight. So when people say I'm just going out into daylight for some vitamin D, that is one tiny element of daylight sunlight exposure. But going back to photobiomodulation and circulation, we see it both at a very acute level with regards to improved transient circulation in the area that you shine the light on, both through dilation, again, nitric oxide, improved vascular health, reduced inflammation, etc., etc. All these things are improved or shown to be improved through photobiomodulation. But we also see it in the longer term with people suffering from diabetes, and the issues caused by diabetes in the extremities, with regards to wound healing, etc. There is good evidence in the research showing improved wound healing capabilities, improved in diabetics, but not just in diabetics, in normal populations as well. Improved wound healing through the things that I've mentioned before, but not just, again, in a short space of time improving wound healing. We also see it in conditions like Raynaud's phenomenon, or Raynaud's disease, which is a circulatory disorder issue, where people are left with very cold extremities. If they get them even slightly cold, they stay cold for a long period of time, to the extent where it can be painful. And the research studies suggest that with the use of photobiomodulation we can reduce the severity of the symptoms experienced, but also reduce the occurrence rate that your body experiences these kind of outbreaks of Raynaud's phenomenon. And it also, what they've started to establish now is that the photobiomodulation is able to help your body adapt to how it reacts to the cold if you have Raynaud's phenomenon, which is a brilliant thing, I think, having someone in my close family that suffers from Raynaud's. I've understood how painful it can be and how annoying it can be and how frustrating it can be. So having a photobiomodulation device in the home is able to help her modulate the severity and the occurrence of this Raynaud's phenomenon, because it's able to help your body adapt to cold exposure. So going back to the point, can light therapy, can photobiomodulation help with circulation issues? Yes, in a very wide range of scenarios, or so the research says. And I've given you examples of diabetic, I've given you examples in diabetes, I've given you examples in circulatory issued phenomenons like Raynaud's, also in terms of wound healing. We see circulatory issues also occurring in other men's health issues, which have been primarily looked at. We see also circulatory issues with regards to muscle recovery, with regards to brain health, which have all been influenced by photobiomodulation in various research papers. So yeah, there is a strong link between photobiomodulation and various circulatory issues, but not just photobiomodulation. Just getting out into the sun and exposing yourself to sunlight will have positive impacts on vascular health and circulation as well. So yes, there is a link, and it's a positive link, and if you want to know any more, just get in touch and I will help you in any way that I can do. For now, just have some sensible sunlight exposure, and that will help with that should help with any circulation issues that you have. Have a great day, stay healthy, and as always, if you're